You won't be able to tell how many centimetres your cervix is dilated because you can't see it. The only way that can be found out is when you go to hospital and they do an internal examination and feel how open the cervix is. Women have a number of worries about what will happen during birth. They worry about pain, they worry about the baby's well-being, they worry about their own well-being and their ability to be able to give birth to their baby. Your midwife will be there to support you during the birth, and doctors, if they're needed, will also be there to support you. Lots of care is taken, whether you're at home or in hospital during labour, to listen to the baby's heartbeat regularly to make sure that he or she is doing well, and to monitor your blood pressure, your pain and your comfort, and how you're managing. One of the worries that women do have is whether they'll need to have a cut or an episiotomy as the baby is being born. It's very frightening to think that this might happen to you, but it may be reassuring to know that most women do not feel that happen because of the pressure of the baby's head on the tissues around the opening at the time, and most commonly you will be given some pain relief before the episiotomy is done, and that will be discussed with you beforehand. Years ago, it used to be routine that all women would have an episiotomy or cut at the opening of the vagina as the baby's head is about to be born. That's not routine now, and is usually only done if there's concern that you're going to have a big tear or if the baby needs some help to be born with forceps. A small tear will heal much more comfortably and easily than an episiotomy. Once the baby is born, the placenta needs to be delivered. That's usually something that most women don't take any notice of at all and is not a painful process. It usually happens somewhere between 5 minutes and 40 minutes after the birth of the baby. Most women are offered an injection to help speed the delivery of the placenta, but that's something you will have in your birth plan and you'll discuss during antenatal classes as to whether this is something you want or not. You may want to discuss something called delayed cord clamping with your midwife, which will enable more blood to go back into the baby's system before the cord is actually cut. Some women will need some help during birth to deliver their baby. Most women are completely able to give birth to their baby by themselves, but sometimes things don't go according to plan and they'll need a little bit of assistance.